Good morning, everybody. I'm once again delighted to be here at the National Institutes of Health, to see the wonderful work that they're doing to save lives, to help people return to their livelihoods, and to be able to develop either those cures or those helping drugs and interventions that enable people to live productive lives and go about the activities of daily living. I'm here, though, today, not in my capacity as the senator from Maryland, in which many visitors have gone before. I'm here today as the chairperson of the Full Appropriations Committee, that committee that puts money in the federal checkbook to make sure the American government does the job that the American people want them to do. And I'm here with representing both myself, members of the Appropriations Committee, and we have a bipartisan group of staffers with us to listen and to learn, to find out what does this sequester mean to the National Institutes of Health. Sequester is a Washington-speak word that nobody understands. Nobody knows the meaning. Nobody knows the consequences. But in plain English, straight talk, sequester means that on March 1st, there will be across-the-board cuts in every single program, with the exception of men and women in military uniform and veterans. It means in the National Institutes of Health, there will be a 5% across-the-board cut in every single program, every single research endeavor, and also in education and training, and promising new ideas to be explored, again, to help people. Today, I'm surrounded by people who have either won the Nobel Prize or who ought to win the Nobel Prize. But they don't want to win that prize. They not only seek to win that prize, they seek to run the race to find the cure for Alzheimer's, autism, even if we stuck with the A words, arthritis, AIDS, breast cancer. We race for the cure, so we should race to end sequester. I wanted to hear firsthand what it would mean. Well, first, it will be an impact on 15,000 Marylanders who work either at NIH or who benefit from the research funding at other Maryland institutions, whether it is Johns Hopkins, the University of Maryland, nearby institutes. It will also have a direct impact on Maryland's vibrant biotech industry. But for the nation, it means those 15,000 Marylanders could either face cuts in their research and in certain areas of endeavor might even be furloughed. Well, wow. So instead of, the world wants to give them prizes. The world beats a door to our door, but what are we doing? We talk a lot about threats to the United States. We fear foreign predators and terrorism. We fear foreign competition. Oh, what are the Chinese doing? But we are about to inflict upon us a self-inflicted wound. So I looked at the numbers. Everybody talked about, it's math. Well, I'm looking at the math, and guess what? At NIH, the sequester cut means $1.5 billion. $1.5 billion. Now, the funding for NIH is $30 billion. People go, wow, $30 billion. It is a lot of money, but look what its impact is on our society. Now, over 10 years ago, the United States Congress, on a bipartisan basis, began to double the funding at NIH. We knew that we were in a race for the future, for the innovation economy, to come up with new ideas and new research and new opportunities to help people, where we could help people in our own country and develop the products FDA approved that we could sell around the world. We were the turbo engine of the innovation economy. We went from $13 billion to $27 billion in 2003. But as the Iraq War went off, our war against disease began to slow down. So now, yes, we have $30 billion, but we know that that has meant a cut of over 20% in purchasing power, whether it's the number of research grants that can be awarded based on peer review, or whether it's the number of Petri dishes we buy from the private sector economy. And what have we been doing with all the money that we gave NIH? Well, guess what? Just when we knew Sequester was going to happen, NIH announced that it had cut cancer death rates by 11%. 11% in women and 19% in men. What are we finding? That HIV/AIDS, under the leadership of Dr. Fauci, no longer a death sentence. We know that around the world, we love what Bill Gates is doing, but Bill Gates couldn't have done what he's doing without NIH, and we have eradicated polio and smallpox in our own country, and we're doing it around the world under the American flag, under the flag of international public health. The world loves America because we are helping them in every village around the world. These breakthroughs occurred because of government-sponsored research. Well, right now, we're on our way to these cuts. I fear that the $1.5 billion cut in NIH will delay scientific projects, will make hundreds fewer research awards, therefore jeopardizing thousands of jobs. It will delay progress in research in debilitating conditions like Parkinson's or Lou Gehrig disease, or what took my father's life, the consequences of Alzheimer's. It also means that in communities, states, that, and it's not a state government that receives NIH, it's usually the iconic medical institution that receives NIH funding. In my own state, it's Hopkins in Maryland. In Senator Moran, who is the vice chairman of the labor HHS in Kansas, it's the University of Kansas. So research is going on in every community, every medical school, working with public health, medicine, nursing, social work, to see what are the breakthroughs. Johns Hopkins anticipates the non-defense cuts could result in over $60 million in reduction. That will have a direct impact on jobs, on the progress of research, and quite frankly, on hope. The National Institutes of Health stands for health. It could be the National Institute of Hope. Hope that you'll find that cure, that you'll find that help, that you'll get a helping hand when you face a draconian or even orphan situation. If you're a young person who has been good at math, good at science, everything the president says he wants you to be, but then when you want to go ahead and study, the money to help you with grants and fellowships shrinks and shrinks and shrinks. And if you go into crushing debt to get that MD or PhD, what happens to you? You stand in line to get your research. It means that those audacious, bold grants could be cut. I was stunned last week when I read that under Dr. Collins's leadership, there were 22 grants in ophthalmology called the audacious grants. And they were meant to find those young people with out-of-the-box ideas to come up with new ideas for diseases that affect the eye, from genetics to cellular regeneration to bionic prosthetics that could restore sight, restore vision at the National Institutes of Hope. If we do that, but look, that's going to be cut. What's going to happen to those 22 grants? And just the other day, FDA approved a bionic prosthetic device to improve the eyesight and eliminate blindness. This is why I call it the National Institutes of Hope, the National Institutes of Health. So we've got to stop Sequester. And I'm going to work on a bipartisan basis, hands across the aisle, hands across the dome, to come up with a solution. We have a plan. I have a plan, working with the Democratic leadership, for a balanced approach, finding revenue, strategic cuts, unneeded programs, and we can do it. In the program that I'm advancing with my Democratic colleagues, we will have 50% in revenue, plugging loopholes for sending jobs overseas, implementing the Warren Buffett rule that says on your second million, pay as much taxes as your secretary. And we will have strategic cuts in farm subsidies for $27 billion and another $20 billion cuts in defense that will start in 2015 when our troops come back home. I have a plan for $86 billion to end sequester. If it were passed today, they could all breathe easier tomorrow. So know that I will fight to end sequester, to end doubt and uncertainty, and this draconian approach to dealing with the budget. I am so pleased that my Vice Chairman, Senator Shelby, sent his top staff here to hear what I hear. I'm so pleased that Senator Moran, the new ranking member of the Subcommittee on Labor HHS, also sent the staff. We might not agree on the exact policy, but we do agree that we must end sequester, come up with a common sense to do our budget, and let the brilliant people in our country continue to be the National Institute of Hope. And I look forward to working with my colleagues to end sequester and to make sure the vitality, vibrancy, and vision continues at this great institution.